I'm Chronically Jenni and welcome to another EDS Awareness Month video. This week, I asked my beautiful dazzle of zebras what they wanted to share about living with EDS and HSD with their doctors. In medical school, doctors are taught that when you hear hoofbeats, think horses, not zebras. That basically means that they should diagnose and treat the most obvious and common cause of the symptoms. This is sensible in some respects. You don't want to be diagnosing everyone with something rare and complex when it's just a cold or a stomachache. But that means that however sparkly we are, us zebras can be missed. I know that unfortunately it's been my experience and the experience of many other people with Ehlers Danlos Syndrome, especially hypermobile type, which doesn't have a genetic marker as yet, that they are disbelieved and misunderstood and told that it's all in their head. I was told that my postural orthostatic tachycardia syndrome was simply anxiety. I was told that the pain that I was feeling was being caused by taking too many pain medications. And I had a neurologist tell me that there was nothing wrong with me at all, when it turns out I had a cerebrospinal fluid leak that had been causing me the most horrific headaches for so long. I was very lucky in finding a doctor that noticed my EDS, my POTS, and my CSF leak all in one go. But it took time and it took a lot of trauma. Here's what my zebras want doctors to know about EDS and HSD.
It can take a really long time to find a doctor or a consultant who really understands EDS and what you're going through. I mean, it took me 35 years to get my diagnosis and a lot of heartache along the way where I was just dismissed and people either didn't want to listen or couldn't help and dismissed me. And I think that dismissive approach can be really, really emotionally devastating for a lot of people and heartbreaking. So I'd really like more education, more time, more empathy. And I think that would be a huge step forward into helping us.
One thing I'd definitely like to change about how EDS is treated is to truly, again, hone in on that multi-systemic thing. Like for lupus clinics, they have the rheumatologist in clinic, and then if they have kidney involvement, they'll see their nephrologist, and for whatever involvement, all of those specialists are in clinic at the same time. I mean, how amazing would it be for us to be able to go to an EDS clinic once every 3 months, once every 6 months or whatever, and see a rheumatologist, see a neurologist, see a gastroenterologist, all of the, a cardiologist, who are all knowledgeable in EDS already. It means you don't have to fight to get the treatment that you need, and everything's all in one place.
Doctors, like GPs, don't understand EDS. When I was little, my GP pulled my neck and my ear and said I couldn't have EDS because it wasn't stretchy enough.
I would like doctors to understand EDS better, especially GPs. I think they are the level that are lacking the understanding in what this is and how to diagnose people. I wasn't diagnosed until I was 35 when my children were diagnosed.
That just because it's invisible doesn't mean it's not real.
I think what would fix a lot of the issues that many people with EDS face when it comes to medical treatment would be fixed with more education for doctors and other medical professionals, because a lot of the times they have many misconceptions, so they don't fully understand the condition, and it just leads to misdiagnoses and poor treatment, like really, really poor treatment that should never happen.
And now if we talk about doctors, I would say that what we need the most is definitely more research, because currently there's not much information available, especially here in Latin America or in Chile specifically. As I said, there's only one specialist in the whole country to treat all the patients. So as you can imagine, there are not many diagnoses done. So there we have patients who literally die waiting for a diagnosis or waited for years to get one. In my case, it took me about 6 years to know what I really had, and that is because doctors don't really get interest in this kind of illnesses. I'm a med student, and I've already heard that phrase saying that if you hear hop steps, think horses and not zebras. And for me, that's really silly. For me, zebras, we do exist. We have zebras all over the world, so we need more research for them.
We should be treating everything seriously and with more compassion than we are now. Because I think if we looked at every single angle and we just stopped trying to pick up the simplest explanation, then we would get so much farther, and it wouldn't take like 6 years for people to get diagnosed.
Things that change about how we are diagnosed and treated is how often we are dismissed. Our symptoms are often ignored, and we feel like we're not being listened to by professionals. The lack of knowledge and the awareness of the illness within the professional medical field makes it hard to get a diagnosis and therefore the appropriate treatment.
That our symptoms aren't dismissed. That we aren't told that we're faking it, or even given the idea that we could be. Like, this is what we have to deal with. We're coming to you as a patient, you being our doctor, and you're trying to dismiss us or tell us that there's no way that we could be dealing with that. So you just tell us we're faking it, or that we're wasting your time. And I mean, a lot of doctors are like that. They don't believe us. There's nothing else we can do except go to another doctor who may or may not believe us. And that's scary. It took me personally 5 years before I was even given the idea that I could be diagnosed, that I wasn't faking it. And that's what a lot of people go through who have this. So yeah, I wish doctors were more willing to diagnose, willing to think outside of just the common diagnoses, and more willing to see that zebras are out there. They're just being overlooked.
I would like doctors to know that we're out there and to take the time to listen to your patients and realize that the zebras are there. 33 years for my diagnosis. Probably way too long.
So there is a whole bunch that I would love to change about the way doctors treat EDS patients and the way that we are diagnosed, because it typically takes way too long to get diagnosed. The disease seemingly mainly affects women. There are definitely cases of men, but for the most part, it tends to affect women, and women are notoriously not respected in a hospital setting because we are typically treated like we're just being overly emotional when we complain about pain. And so getting diagnosed is very difficult. And I think for me, the biggest thing that I would love to change is just compassion and understanding, and having doctors put their ego aside for like just a second, because patients like us are very challenging for doctors, because doctors are used to knowing what to do and understanding the patient. And when we walk in the door, they're like, where do I even begin? And so, yeah, I'd like hospitals to start teaching more about all of these rare disorders, because I think for the most part, the comment I get is, oh yeah, I know EDS. I was taught about that for one day in college one time. And one of the nurses I was talking to last time I was at the hospital said that they only had 2 pages total in every single page of their medical books that explained EDS. And she said it was a very, very basic explanation. And for something so complex, you can't have a basic knowledge on it. So yeah, understanding, compassion, intelligence and knowledge, and just spreading more information would be amazing.
Just because you may have anxiety and depression does not mean that everything is because of anxiety and depression. Mental health does come with the condition for most people, and physicians need to understand and separate that from the physical and the main aspect part of EDS, that people can have both, and that it's not just one thing or it's not just another. And it really irritates me when a lot of us, when we're first trying to look for a diagnosis, that, oh, it's just all anxiety and it's just all in our heads, when in fact it's not.
I think it's really tricky, especially when you talk about treatment with EDS, because there is no cure. There's definitely ways you can manage it. I've totally found that. But at the end of the day, a lot of times there's not much doctors can do. But often they admit that all too quickly. I really wish doctors knew that there are different management strategies out there, and that there are often clear paths you can take in getting the treatment you deserve. Because I've been told one too many times by a doctor, yeah, okay, you have this, but you just have it. There's not much we can do about it. When I've gone on, and only through pure luck of knowing myself and finding out that there have been pathways. For example, I was told that by a rheumatologist when I was wanting to go on a 3-week rehab course. And she, if I hadn't have known about that rehab course, she would have just told me to get on with it. And I would have listened and been a lot worse than I am now because of that. I really wish we didn't have to advocate for ourselves and our medical treatment as much as we do.
One change in diagnosis and treatment in the medical field would be faster genetic testing, easier to get a referral, and better insurance coverage.
To have better pain management. I think that would improve our quality of life so much for so many of us living with this. So when I was actually diagnosed when I was 16, the geneticist told me that I know you're in tons of pain, but I don't have anywhere to send people like you to get treatment. And I've never, like my entire life, I've never known being alive without being in pain, like at least some part of me being in pain. And adequate pain control would bring so much to my life.
I know for most people it is a long road to diagnosis, and when you do have that diagnosis, a lot of the time it's the end of the road. There's not much in the way of further treatment. You sort of just have to deal with it on your own a lot of the time, which is pretty difficult.
Probably just easier access in regards to genetics and the diagnosis procedure itself. I was pretty straightforward. I had it quite easy to get diagnosed due to having issues with multiple aortic dissections in my aorta and lung area. And then I also have a family history of sudden death at early ages, so they really pushed for my genetic testing, which led to my diagnosis of VEDS. But I always hear other people struggle to get their genetics done, and it's not as straightforward as it was for me, so it's just easier access.
One thing I'd like to change about the way EDS patients are treated by healthcare professionals and doctors is that our pain is very real. Just because they can't necessarily see the pain that we're in doesn't mean that we aren't telling the truth.
Well, firstly, be to be believed, and secondly, to reduce the time to diagnosis. It took years for me to get mine, as symptoms are often not linked up together and patients sometimes cannot be believed. I hate to think that others have been treated in the way that I was. Personally, for me, I found there are no local specialists, no diagnosis centres or services. I had to go to London to get my diagnosis and for further treatment, and within the EDS community I found that others' experiences mirror mine.
Adult genetic clinics need to accept more skin and joint patients, because most of them will only accept cancers, or like if somebody's trying to have a baby, test for genetic defects. And that makes it really hard for us older people to get diagnosed.
I would like doctors to educate themselves more on Ehlers Danlos and its comorbidities. I would also like them not to leave us alone to manage our symptoms.
One thing I'd like to change about how medical professionals treat EDS
is the stigma associated with invisible illnesses and chronic disorders. Quite routinely, you can find yourself going back and forth to doctors' practices and not being taken very seriously, and instantly it's assumed that either you're there to be pushing for drugs, or that you've not put any self-care in, or that you want a quick fix, or you've sat on the internet and Googled. And all of those are really unhelpful. There's always this underlying assumption that you don't want to help yourself. And the number of times I've gone in there to doctors' practices and been told, you'd have none of these symptoms if you just got off your butt and did some exercise. When I'm sat there exercising on a daily basis to keep my symptoms manageable, that's a really unhelpful thing for someone to say, as if it's my fault because I'm not doing enough. There are 24 hours in a day, and there's a finite amount that you can get done in a day, but it's my fault for not using my time better. So if that's one thing I would love to tackle, is just that stigma that's associated, that people with chronic illnesses are looking for a reason to be sick. Nobody enjoys being sick. Nobody does.
I wish doctors of all types, including pediatricians, really listen to their patients. I think people are... there's a lot of misdiagnosis and put-offs by doctors, and I also think that just comes back to the awareness about EDS. But May is EDS Awareness Month, so let's EDS awareness.
When you are a child, they don't take you seriously. They told me, like to my 20s, that what I had was growing pains. I think since most of the symptoms is fluctuating and not so visible, health professionals have difficulty to take seriously patients. When they don't know right away what can be, they mostly think that it's all in your head, you know? But nowadays, I am so blessed to have found health professionals who truly believe in me, seek answers, and improve my quality of life so much. It is a really much more beautiful journey when we have professionals who believe in what we say, who are truly interested and really look forward to help us.
I am doing this awareness video because we need better care and access to treatment. Because I often have to spell and describe Ehlers Danlos to doctors. Because I have to fight with insurance to access needed care. Because I have to find my own treatment options and suggest it to my doctors. And I would like that to change.
Something that I'd really like to see change is the time for diagnosis. And I know this is brought up a lot, but it really can take years and years to get a correct diagnosis. And I appreciate, obviously, as like I said before, that people have different symptoms, so it is really difficult to diagnose. But I think there should be more kind of pushing to find an answer. A lot of the time, especially in my experience, it has been fobbed off for just being accident prone or growing pains, rather than kind of looking into it more. And even then, I think once people are diagnosed, something I'd like to see change is then the treatment. Obviously, there is no cure at the moment, and it is something that we're all going to live with for the rest of our life as a genetic condition. And I think the support there could be improved. I mean, there are brilliant programs out there, but again, personally for me, it's taken years to get onto these, and I still am waiting for that. So I think just further support and a holistic approach, because otherwise you often just get sent to all these different specialists all over the place. I mean, I'm seen under so many different hospitals that don't talk to each other and don't communicate, and so your care is kind of very sporadic. And I think a holistic approach, which, you know, there are centres that are striving for that and pushing for it, I think that's just really needed, and that ongoing support for the treatment and kind of management of it and that side of it is something I'd really like to see, and hope that in the future it's just more commonplace, and even that takes less time to get onto.
Thank you so much for watching, and I really hope that's helped you understand some of the difficulties we face in getting treatment and getting a diagnosis of Ehlers Danlos Syndrome or Hypermobility Spectrum Disorder. It's a tricky thing, but I do wish that one day it will be as easily understood as more common conditions. Thank you again for watching. If you've liked this video, please give it a thumbs up. And if you haven't already, I would love it if you'd hit subscribe. I will see you again soon for another EDS Awareness Month video. Spoons and love. To find out more information on any and all types of Ehlers Danlos Syndrome, please visit ehlers-danlos.com to visit the Ehlers Danlos Society website and find out all about Ehlers Danlos Syndrome. I'm also doing a fundraiser this year, as obviously the coronavirus pandemic has taken a big hit on charities. So if you go to the link in my description, you will find my EDS Awareness Month fundraiser. I really hope you can donate if you can. Thank you.